Chapter 3, Lecture 4. In this lecture, you will learn about 2 other economic evaluations besides the 4 other economic evaluations that you learned in the previous lectures. Let's start with the human capital approach, which is used to determine the monetary worth of a life. This actually approach involves estimating the discounted value of the future earnings resulted from an improvement or an extension of life. So if you have any project that can increase the life expectancy, we only calculate the market value of the outcomes produced by an individual during his or her expected lifetime. So what does it mean? Means that if, for example, we have a project that increase the number of the years that the person can live, and we only care about the people's basically life in the labor market, because that's only the based on the output they can produce in the labor market, and depends on their demographic, socio-demographic actually characteristics. For example, definitely, as you expect, men are earning higher than women, so therefore the project can improve the number of the years for men, has actually higher outcomes than improving the basically life years gain for women. So, for example, if a project can increase the life years of people in the age of 0 to 1, then from say that 0 to 1, increase the life years to about say that's 84 years, which is the average life expectancy in the United States. We accumulate all these life years income gained by this person, and then we calculate the human capital gain by this project. So of course, as the people are older, they, for example, if the project can impact the people in this age rate, in this age range, therefore the human capital is smaller, because they have lower basically market value in the labor market. They can't produce the product more than a few years. So of course there are shortcomings of human capital approach. With this approach, you are unable to control for labor market imperfections, such as gender, racial, and other form of discrimination. So of course it doesn't take into account the value of any pain and suffering averted because of the medical treatment. So it doesn't take into account the quality of life. Only it takes into account the quantity of life gained by any basically new project, and only in the labor market. So the value an individual receives from the pleasure of life itself, it doesn't actually include it in this approach. So only the life years gained that the person can actually add the product, the market value in the labor force. So therefore, a chronically unemployed person has no value in this human capital approach, has a zero or near zero value of life, because that person cannot basically add any value to the labor market. although recently, I can say that recently they also control for the unemployed person by controlling the person's sociodemographic variables. So they take into account the opportunity cost of the person with the specific level of education. So and gender and race with respect to the, of course, region of residence. So the new approach is that they also take into account the opportunity cost of this unemployed person in human capital approach as well. The last economic evaluation you will learn here is the willingness to pay approach, which is actually a survey asking the people how much money people are willing to pay for a small reduction in the probability of dying or any type of other chronic diseases. So deciding whether to purchase a potentially life-saving medical services. So basically the benefit is the reduced probability of dying, and then times the value of person's life. So in that case, purchase if benefit just compensate for the cost. The advantages basically is measure the total value of the life and not just the job market value. So here, comparing to the human capital approach, here we take into account the value of life compared to only the market value. Sometimes when the policymakers, they wanted to know how much the people are willing to pay for a specific type of treatment, they actually take this survey to have a better idea of people's willingness to pay. Now, any of the economic evaluations you learned about 6 economic evaluation, any of them you choose, you have to consider the time frame. So whether you're looking at the annual economic evaluation is a lifetime or analytic horizon. So you have to consider that, when you are trying to evaluate the outcomes or costs, you have to be careful of the maturation time for evaluating the outcomes. Sometimes the effectiveness of a specific project or medical care could be evaluated in 1 year or 2 years or more than a few years. That should be considered in economic evaluation. Discounting should be considered for both sides, cost and benefit, because this discounting is the trade-off between the present and future value of the basically any cost and benefit. Usually when you value the future equal to the present, you assign a lower interest rate. And if you value the present much more than the future, so therefore you assign a higher interest rate. Now, since we are dealing with so many assumptions in economics, we make a lot of assumptions because of lack of available perfect information. So you have to basically make a lot of assumptions with different range of low and high range for your parameters. So in that case, most of the time the outputs are sensitive to the type of assumption and range of the assumption. In that case, you have to make some sensitivity analysis, conduct some sensitivity analysis with the low and high range of the assumption to evaluate the sensitivity of the outcomes with respect to your assumption and key parameters. Discounting future costs and outcomes is, even if the program is a one-year program and the costs are incurred this year, the outcomes effects are likely to continue into the future. So you have to determine that how many years you can actually expect the outcome of this project effect on your basically the people in the affected people in your project. $1 today is more than $1 next year, so everybody prefers $1 today to the dollar in the future. So $1 today is worth more than $1 next year, $1 next year, and benefit in the future years are worth less than benefit realized this year. So this discounting is basically is a technique that reduces the value of the future benefits to current values. And if cost occurs in the future, they need to be discounted as well. So both benefit and cost should be discounted, and the selected interest rate determines based on the how you are trading up between the present and future values. Usually, if you you value the future similar to the present, you have to assign a low interest rate. So how we can actually discounting the present value of the benefit or cost. A benefit or a cost received today has more value than one received in the at the future. So the present value of a fixed sum of money to be received a year from now could be discounted by the interest rate, annual rate of interest. So is a present value of the fixed value, benefit or cost, by the 1 plus interest rate. Usually, in general, the interest rate is used something between 3 to 5%. Now, the present value of a fixed sum is inversely related to the rate at which it is discounted. So the present value of the sum of the money received over the number of the years then equals the payment of the net benefit received annually for t years. So here the present value of the fixed value costs and or benefits in different years should be inversely related to the interest rate. Means that as you're increasing the interest rate, the present value decreasing. So the present value in terms of benefit and cost over time, the net benefit is the present value of the net benefit, which is the summation of the benefit minus cost discounted by the interest rate over the years. Choosing the interest rate, if you choose too high, this may result in the choice of medical interventions that offer short-term net benefit. So what does it mean? Means that when you're choosing the interest rate too high means that you're giving a short-term net benefit in the future. You're assuming, and if you assume too low interest rate, This may result in the choice of medical projects that provide a long-term net benefit. So you have to carefully choose the interest rate. When you choose low interest rate for example, for an educating the healthcare personnel, you show long-term net benefit basically, and that makes sense. That's a usual case we have, that we assign a low interest rate for education in most of the countries. Now, the sensitivity analysis means that the results of economic evaluation may be sensitive to the assumption used to estimate both cost and benefit and choice of the outcome measures. So we need to know how changes in this affect the results. Means that you determine the key variables, the key parameters in any project, and you determine the range of the low and high in any of these key parameters, how they affect the total outcomes. So that calculate the summary measures using different assumptions in the success rate of intervention, valuation of costs and valuation of benefits, choice of outcome measures, discount rate, and outcome measures. So these are all key parameters in any usual project. So you always have to consider the worst and best case scenario, and means that the low rate and high rate in each of these variables, parameters, and then check the outcomes and see how those outcomes, the main outcomes, are sensitive to the worst and best case scenarios. The Patient Protection and Affordable Care Act, ACA of 2010, actually had this basically goal to provide people with the knowledge needed to make this educated decision regarding the medical care. So previously we didn't, in the United States, still we don't have that economic evaluation. The only official evaluation we have is the safetiness by FDA. We don't have any cost effectiveness evaluation in the United States. But in the Affordable Care Act, basically we started to think about kind of comparing the effectiveness to give these people this information. The cost effectiveness ratio, the comparative effectiveness ratio, simply helps the people to know what works and what doesn't work. So then this comparative effectiveness research considered as a public good, because it's the information that provides people with the kind of knowledge that they can make a better decision about basically choosing the best medical care. Now, in the assignment, one of the assignment, we had a question about how to measure cost benefit of evaluating a smoking awareness program. If we wanted to list the cost, we have to list the direct and indirect medical costs, and then also non-medical costs. The direct cost of a smoking awareness program includes any advertising expenditure plus the combined salaries of the team of the healthcare professionals conducting the seminars. The indirect cost includes the dollar value of the foregone production, that results when workers in various firms, they're attending to that seminar, the 60 minutes. So you have to basically calculate this, their foregone earnings, production, basically, based on their salary rate per for 60 minutes that they missed. The benefit includes the dollar value of the medical expenditure diverted because of some of these people may actually stop smoking or decrease the number of the smoking, and monetary value of the increased production that may actually result in the labor market. And the utility gain because of the increase in quality and quantity of life. So that should be actually included, and all of these benefit and cost should be discounted to reflect the element of time. So we are done with lecture 4 as well.